Hi, good evening, friends. We are back today. All right,
Good
today we are going to
everybody.
talk about, we are talking about basic information on bone structure. And of course, all of us know that bone is very important, right? So today we are going to share about the function of bone. And of course, we are going to talk about the common bone diseases. And many of us have heard about osteoporosis. We are going to share about how we can prevent fall, and also talking about bone exercise and our spinal structure. And at the end of it, we're going to share about a healthy lifestyle for our bone, and together also with food and nutrition for our bone health. So without further ado, I would like to pass on to our health coach, Miss Rosa. Back to you, Rosa.
Hi, thank you, Sue-Ann. Hi, everybody. Good evening. So today we are talking about bone health. So let me share the screen for some information. We have prepared some information for everybody. It's a very basic knowledge about our bone. Okay, so here is a picture about the division of skeleton. We have the axial skeleton, including the skull, the spine, and rib cage. Here it is. And then we have the appendicular skeleton, which include the upper limbs, the lower limbs, shoulder girdle, and the pelvic girdle. So what is the function? What are the functions of bones? Bones support our body. It is also a protection of our soft organs. You see, we have so many organs inside our body. It is a protection for our soft organs. And it also is a movement due to attached skeletal muscles. So we have all this movement because we have bone. So with the bone, with the muscles, it forms our movement. And bone is also a storage of minerals and fats. Can you imagine it? Bone is storing our fats. And bone is also a blood cell formation. So according to World Health Organization, musculoskeletal diseases are the leading causes of global disability. So a lot of people cannot move freely, do not have mobility because of bone disease. The lower back pain is the leading cause of global disability. And these diseases and injuries are not only problems of old age, and they are not limited to old people. Even young people have all these diseases and become immobile, become disabled because of bone disease. They are very common throughout life. 1/3 to 1/3 of people suffer from painful bone disease. So severe limit mobility and flexibility, leading to early retirement. Because we cannot move freely, we do not have the ideal mobility, we have to retire early. Have you heard of people who cannot walk very well, feel so tired to go to work every day because of disability? And also they have to opt for early retirement. So they also have less accumulated wealth because they cannot work for their health and for the wealth. And because they cannot move freely, because of the limited mobility, they also cannot participate in a lot of social activities. Sometimes even family gathering, they are not able to attend or they do not want to attend. And all these cause a lot of pain and pain in our physical body and pain in our mind also. So it is a cause of depression. So look at this list of bone diseases. It includes joint problem, osteoarthritis, rheumatoid arthritis, gout, and gout itself. Everybody knows about gout, right? Because it's so painful. You can wake up from your sleep if you have a serious gout problem. And also osteoporosis, brittle fractures, spine problem, a lot of pain, inflammatory parts of your body, which also cause pain and blockage. So connective tissue also will be a problem. So just now we we're talking about osteoporosis. Let's look at this picture. On the left-hand side, this is a normal bone. The other side, the right-hand side, is osteoporotic bone. The density, you can compare the density, is so much less in bone mass, right? So we say it's a loss of bone, leading to possible fall or breaking, fracture of bone, because the bone become very fragile. So our bone actually can be rebuilt. They remodel, we call it remodel. Osteoplasty rebuild the bone. So every 7 to 10 years, our bones will be broken down and rebuilt again. So for young people, we always have a period of time, a stage of life where they can grow very fast. They can grow tall very fast, right? That is the period when the bone is broken down and rebuilt, even into the adulthood. So this is a graph that I want to show you is about your bone mass. You know, when you are young, from age 15 to 25, sometimes about 30 years old, your bone is at the peak. It's the peak bone mass. So your bone is strongest at that time and growing very fast. So when we reach menopause, in ladies and in men, actually, we also have menopause, your bones start to reduce in bone mass, in the density. So as we grow older, the bones will deteriorate. You know, the building of bone is much slower than the breaking down of bone. So we actually have less bones, less bone mass in that case. So these are, you can see when you are young, a young lady like this, the back is very straight because the spine is very strong and very straight. And as we go into middle age, you can see the hunch start to appear. And when we get into older age, we really have to, our body is bending down, right? This will result in reduce in height, and you feel more difficult to breathe because your organ, your lung is pressed by the curved spine. You know, you can see here, the spine is curved, so this rib cage is pressing on our internal organ. And most likely you will have a lower, a less ideal appetite. And that will be affecting our digestion also. So these are some exercises that we can do to improve our mobility, even though into middle age or old age. So something like this, get up from a chair without arm, you know, that is to strengthen your legs muscle. And modified squat, squatting is a very good exercise to strengthen your legs muscle. And wide exercise, this is the wide exercise. Now just stretch your arms up and move it down and balance on one leg. Maybe you can try this exercise. You just stand on one leg and see how long you can balance. The longer you can balance means the healthier is your bone and your balancing power. So we also will want everybody to keep an eye on your weight. Now, don't get too heavy, because that would be a burden to the leg and the whole skeleton. So this is some exercise that we can do to strengthen your balance and to prevent fall and fractures, like walking, weightlifting, jump rope. This is very interesting exercise. Dancing, jogging, pilates, and yoga. So depends on your body condition. You can maybe consult your doctor before you're doing any exercise, because some people have different body condition, different health condition, and even age is a issue for people who do exercise. So make sure you won't be hurt, you won't be injured with the exercise that you do. So there are some things that we can do to avoid falls at home or from when we are moving. First thing is stop multitasking. As you know, we ladies always multitask. You know, while we are looking at the phone, we will be driving. I don't. You should not be using phone when you're driving. But when you're walking, a lot of people are still watching, still reading the phone or sending message. So please avoid that and remove trip hazards. Hazards. That is like something blocking the passage, or you have clustered of things in your room, in your passage, in your living room, or even in your car. You know, I see some people, they have the umbrella on the side of the car, or they have shoes blocking there. So just make sure you clear these things. So if you are in a rush and there are things blocking you, you might fall very easily. So also get your eyes checked because of eyesight. Eyesight issue happen in all sorts of age groups. So if you are feeling you have a feeling that your eyesight is not very good, please go and check your eyes and get the necessary aids. Sometimes we just fall because we cannot see. You know, a lot of short-sighted people will just pump into a glass that they don't notice. And also keep a night light on, because at night we are so in Malaysia we say we are very blurred at night. So you are not very alert. Maybe you are half awake, half asleep. So just make sure you are very careful and you have enough lighting in the room, so that you, when you get up to go to the toilet or just to move around, you have enough lighting on. You can see clearly where you are going to. So instead of knocking on something and fall, right? So also, if you have, especially if you have old people in the house, please install grip bars on staircase and bathrooms, because these are the places where you can fall very easily, the staircase and bathroom, especially these two places. Please install grip bars for if they have a limited mobility or if they have not very good eyesight, please do install and use them. A lot of people, they think they are quite good. They overconfident, we call it. So they don't use it, even their grip bars on the or handrails on the staircase. So please use them, and also get your medical checkup, because our health will also affect our balance. So if we are we have giddiness, or we have high blood pressure, or even diabetic, you please do check your health and make sure that you know what situation you are in. So according to statistic, 2 million people land in emergency room from fall. Over here, we have lifestyle. So we hope everybody will take care of your lifestyle so that you can have a very healthy bone system. First of all, consume some calcium in your food, and take vitamin D, or just go out for some morning sun. Quit smoking. Smoking is one big thing that we should avoid continuing, and limit alcohol consumption. Just today we are talking about drinking beer. You know, when you are happy, we drink beer, we drink alcohol, but limit it. Just don't abuse it. Yeah, just limit it to a certain amount that it won't help. It won't affect your overall health and your bone health. So regular exercise, regular physical activity, and good posture. You know, if you keep in a very unhealthy posture for a long time, it will affect your bone structure. It will just make your bone and your muscle into a certain position, which will give you a higher risk of falling and bone fracture. So if it's necessary, please consult your doctor. Please go to a doctor and get the necessary medication. Yeah, and also avoid low body weight. don't get too slim. A lot of young girls like to get very slim, and even old people, because we understand that getting overweight is not a good idea, but getting too slim or too thin is also not a good idea also, because your body need muscle to support the weight, support your physical activity. So here are some causes of back pain and also for unhealthy bone. First of all is our eating, our diet. Our diet can be so unhealthy that it affects our overall health, right? Of course, that will affect our bone health also. And high heels, ladies, please try not to wear high heels all the time. Give your give your feet some resting time. And poor posture, this is what we said just now. You see, if you are always in front of a computer or always looking down at your phone, just take note. Give yourself some time to stretch, to do some exercise. Yoga is a good exercise. Yeah, so just do it according to your limit. And the old mattress is also a problem because when mattress are getting too soft, it will give you bone problem because your spine will be shaped according to the curve that your soft old mattress is giving you every night. You sleep in the mattress for 6 to 8 hours a day, so it will shape your bones. It will damage your spine. So age is also an issue for bone health. So make sure you have all the things in place, all the diet, all your lifestyle, and all the necessary vitamins and nutrients that you need to go into healthy bone while you are aging, right? Arthritis, poor working posture, and obesity. Obesity just now, I just want to remind everybody, obesity is a problem, is a worldwide health hazard. So just watch your weight. We'll be talking more about maintaining an ideal weight later on in our other session. So please stay tuned. So what about food? Food, there are many things that, especially vegetable, that we can get our calcium and our other trace mineral, right? So just take care of the food that you eat. There are vegetables which contain calcium, but your body may not be able to absorb all of this. So this is where the nutritional supplement comes in. You know, we will have to supply our body, because we are not, the world is not like last time. Society has so many kind of toxin and pollution, so we really need some help in our diet to absorb the necessary, to have the necessary nutrient and ingredients to boost our health. So there are many factors affecting bone development and growth. Deficiency of vitamin A, vitamin C, vitamin D. So sex hormone, if you look down here, the sex hormone is also affecting our bones health. So physical stress and mental stress will also affect our bone health. So this is about all we want to talk about, the basic bone health. Pass it back to you, Suen.
Wow, thanks, Rosa. It's so informative. I've also learned so much. And I like the part when you remind us that we need to avoid falling down as age is catching up. You know, sometimes we may become more clumsy than when we were younger. And it was alarming also to know that, as you mentioned, 2 million of people land in emergency room due to fall. Wow. So, and I like the part when you shared about food intake. We need to, all of us know that we need to get good food, right? Food for our body, right? But how many of us actually take all those things, like especially the last chart where you shared about the type of vegetables and the nuts and stuff like that. So I believe none of us are able to eat all of those type of vegetables that is I was just counting just now how many type of veggie I actually eat consistently. So I think it's less than 50%. All right, so it's really indeed very informative. Thanks for sharing, Rosa. Next, we'd like to pass on to Tenny, our nutritionist, who's going to share to us about a product and how this MSM is able to help us to improve our bone condition and even to restore back the condition of a bone to back to normal. All right, back to you, Tenny.
Okay, thank you. Okay, hello everybody. Good evening, everybody. Today we talk about the MSM. You know how it helps our. It help our bone health. Okay, so let's go to what is MSM. Okay, MSM actually is an organic sulfur. Okay, this organic sulfur is normally found in many green vegetables, right? And they have this is a formulation, right? And you find in the green plants, animals, even in the humans, we also produce organic sulfur. Okay, and this is completing with organic sulfur. You have to take together with vitamin C. Okay, and ours is different because we have also this microhydrin in it. Okay, let's go into it further. Okay, we go to the right, we go to the next page. Okay, it reduces joint pain, right? So it will improve our quality of life. Just now Rosa has mentioned joint pain is really killing. Okay, and it has anti-inflammation effect, right? Because our MSM also contain vitamin C. We'll explain later, right? So it will increase our increase our flexibilities. Okay, and it help very speedy recovery after our exercise. A lot of times when we exercise, right, we produce a lot of acidic elements also. So it will reduce our muscle damage and stress. Okay, and it helps to alleviate the athletic symptoms, right, by reducing pain and stiffness. Okay, let's go on and see. Okay, it relieves the allergy symptoms by reducing inflammation. So sometimes we have stiffness, we have inflammation. Suddenly we swells, right? Our limbs, our legs, sometimes even our jaw cells. And a lot of people got swelling jaws. This is very painful, right? Very difficult to, very not easy to tolerate. Okay, and it balances the immunity to help us to stay healthy, right? The skin will be healthier, right? It's strengthened by this keratin, and also it is cancer prevention. Okay, so we just go on. Vitamin C. Okay, vitamin C is rich in is very good for anti-inflammation. Of course, everyone knows that when we have fever, we have cold, we have flu, right? We like to take vitamin C. Okay, let's go on to the rest, to the next page. Okay, this is microhydrin. This one I need to emphasize a little bit more because this is not too common in the health. No, most of the time we don't have much information on this. What is microhydrin? Microhydrin science report written there, it shows that it's protective of brain cells, right? And microhydrin is anti-acidic, anti-free radicals, and also also antioxidant. When it is antioxidant, right, it will kill the bacteria. We fight against our bacteria. So anything when our bones is inflamed, the density is no good, right? So it will extract a lot of bacteria, and antioxidant will fight against the bacteria. Okay. When it comes to anti-acidic, anything regarding acidic, we will feel the pain, right? We feel the aching, right? Bone aching, the neck. Okay, it starts from the neck, hands. Sometimes our hand cannot lift up. Okay, sometimes back pain. Okay, and some people got the what they call the knee pain, right? And also, the foot, right? They find that everywhere pain, right? It is not easy to tolerate. Okay, so this is very good in anti-acidic. Okay, so antioxidant. Okay, because this microhydrin we adding in our MSM, the microhydrin, the molecule is so small, it is 1% of the nano, so it is very easy to absorb, and also for to absorb our sulfur. Okay, once to absorb the sulfur to dissolve the deposit, the calcium deposit. Okay, when the calcium is deposited in our body, right, it forms stones. Okay, when it's if we dissolve the calcium, right, it becomes the calcium sulfate, which is our body required. Okay, so this MSM will help us to reduce the stone in our body also, right, like the kidney stone, okay, like the liver stone, or even the gallbladder, right, it helps. It also produce this sulfur will also help us, our body, to produce nitric oxide. Nitric oxide, right, it will reduce our blood clot, right, in our bone marrow and also in our blood vessel. So thus it also help our heart to be stronger. Okay, right, we go next. Okay. Okay, these two pictures are my family pictures. Okay, the first one is my sister, right, and she has spur. Right, when
Which
she
one
has
is your
spur,
sister, Danny?
pardon?
Which one is your sister? The one on the right hand side, right? This one.
Yes, the one with the baby. Yes. You thought it's me, is it? It looks like
Look
me.
like,
Okay?
yeah.
My
This
sister
look like,
and me actually look alike. Okay. A lot
yeah,
of people ask me, hey, your picture. I said, no, it's my sister.
yeah.
Okay. So she has spur and it is really suffering, right?
Very
She,
painful to have bone spur.
yes. And the doctor advised her the only way to get away to get well is to do operation.
Ah,
So she told me, I said, why not you try on our products, right? I give her some biomedical products and also I give her MSM. Sure
yeah.
enough, he took it in fact, it's less than 2 bottles, right? She's so normal. You see, she's so happy now. She can play with her grandchildren. Okay. The other one is me. Okay. Beside me, there's one center is my
This
sister
is
again,
really
another.
happy, yeah.
Okay. So the one stand beside my sister is my mother. My mother has osteoporosis, right? So she cannot stand up. She didn't fall, as what Rosa just now mentioned, right? To avoid falling, she didn't fall, but she just sleep her her sleep this by just sleeping only.
Mm.
Right? When she sleep. So she got an S in her backbone. She cannot walk. Even with a tongkat or whatever, she cannot walk. Right?
Yeah,
We
it's
feel
very
so
painful.
sad.
That's why if you have an injury in the spine, normally you don't want to
And
walk because it's too painful.
yes, of course, all of us advise her to go for hospital and all this checkup, but she refused, right? So she stay in my house. I give her all the supplements, including most important is the MSM now, right? She stay in my house for about 2 days time. She can start walking, but of course very painful. This is 2 months later. You see, she can stand straight. She always forget to bring her. She always forget to take to walk with her tongkat, right? Which we also say that when she forget means she can walk independently.
Yeah, yeah.
So I feel so happy because this has happened to my family. I think I speak to so many family. I think bone problem will occur to most of the families. Every family will somehow have or rather have a person have a member in the family has bone problem. Not
Totally agree
only
with you. Yeah.
yes,
If
not
you
only
have
old people.
a senior at home who cannot move freely, it would be a big problem for your life. Of course, they
Yes,
suffer a lot, but for the children, for the adult children at home, it become a very big burden to them. Yeah,
mm,
taking care
yes,
of old people who cannot move, it is a really big problem. Mm.
yes. Sometimes we always think it is the old people, the senior people. But lately, because I'm consulting, right? So I find that there are also many children suffer from this muscle and bone problem, right?
Yeah.
Even when they are young. Okay. So we go to the next one, you see. Okay. We share the next testimony. Okay. This gentleman, right? He got an accident. You see the legs are broken, right? So you can see from the X-ray, right?
This
Yes,
is the X-ray he showed us. So there's really a fracture in his bone. This is one here with the arrow, the other one here. Right, so after he take the RBC nutrition, you see this bone, the fracture here is, can you see the palm here? This is the swelling, the inflamed part when he was first injured. This is the healed bone. The fracture is no more, of course the swelling is subsided. The foot also is back to normal.
Yes. So the other one, the lady also, he used to walk sit in the wheelchair, and she cannot walk independently, right? After taking the RPC products with the MSM, you can see she stand up and share her testimony happily. Okay, we go to next. Next is a very interesting testimonies. Now we can say interesting at the time, right? This is Kim, right? Kim met an accident, right? And one of her eyes injured badly, and the doctor declared her totally blind. And she stayed in the hospital. The doctor will also say, right, it takes more than 5 months, right, for her to recover. Right? You can see the writing, although it is so small, right? In less than 3 weeks, right? She can stand up. She can stand in front of us and share with her testimonies. She's very happy. So Rosa, I want to, because I forgot to put one slide. Remember Chris Paul with the elephant? Okay. Maybe we can talk about his story, Chris, Rosa. Okay.
Yeah, we talk about it after you share about this young lady.
Okay. Wendy is a very close friend of mine. Okay. Wendy fell down when she was a baby, right? And because of that fall, that's why you cannot fall down, right? So after that fall, right, she got a humps, right, at the back, at the back of her bones, at her backbone, L2 there. Okay. So from there onwards, her whole body every day is aching, and she cannot stand tall, stand straight, right, with the old legs, right? And she cannot even wear high heels, right? Because she took MSM. After taking it for 1 month, you can see she start wearing high heels.
Yeah, she's wearing high heel.
Yeah.
It's not so healthy if you wear them all the time. But if you have not been wearing high heels as a lady for 30 years, you will be desperate to try it, right?
Yeah. Actually, after 2 months, she can wear very sexily with very high heels, right? But the picture we didn't put it there. But you can see, in 2 months, she can stand straight, right?
Yeah.
And she
This is
becomes
the
so
before
beautiful.
picture. You see Wendy, this lady is called Wendy. You see her shoulder, she has to lift her shoulder because the backbone, there's a hump at the back, right? We didn't show her back now. So this is, relaxed already. It's straightened already. This is after 2 months. And we are very happy that she is very happy.
Yes. She's a happy consumer.
Yeah, she become prettier and more confident and of course healthier.
Yes. Okay. Actually, she looks sweet also. Okay. Ellen is our close friend. Is a close friend of mine, and also a close friend of Rosa.
Yeah.
Right. So she broke the record in Malaysia. Right. She has the most serious rheumatoid arthritis. Right. Her ESR, her CRP is actually is the highest in Malaysia.
Maximum in Malaysia. The highest in
maximum.
Malaysia.
She was even recorded in the magazine. Right?
Yeah.
She took our products. Right? After 1.5 months later, right? Her report, everything is normal.
Yeah.
Okay. Next, the next picture is another person. Okay, we go back to the.
Oh, this
Okay,
one
this is
on the right hand side, right?
this is a very common problem. So a lot of people got yes. A lot of people has a knee problem and they need to go for operation. I know a friend who go for operation. The market price for the operation now is 60,000 for two shoulder, no discount. Not shoulder, sorry, two knees. Okay, one is about 30,000. Two will be 60,000. No buy one free one. Okay, so I have a friend who also do a knee operation, but it cost him a lot of money. Okay, and that not mention his name now because I cost him a lot of money, cost him more than 200,000 because he engaged a private doctor from overseas. At the same time, he stay in the most prestige hospital in KL.
Yeah.
Okay. So he spent about 200,000. When I know him, he was sitting in a wheelchair. You know, after 2 months, the knee was still pain. So I talked to him about MSM. After that, he said, "Okay, no harm trying. After all, I have already spent 200 over thousand, right? The $100 over for MSM it is too little for me." Right? He also said, "I don't know whether I can believe in it. It
And
is
one thing
too."
is that RBC's product is all natural, and most of them are organic. So you can be very
Yeah.
confident that you are very safe taking them.
Yeah. So he tried our products, right? After taking it for less than 2 months, the pain all gone, right? He introduced his brother, right? His brother stay in Ukraine Road, so I go and see him. His brother, his brother is already 80 over years old, so supposed to go for this knee operation because of the age is too senior, so the doctor will not encourage him to do so. So I asked him to take the MSM. After taking the MSM for about 2 months, he called me personally. He asked me, he said, "Now my knee is no more pain. Is it suitable for me to go for operation?" I said, "Why? You no pain already. Why should you go for the operation?" I thought if I pain, I cannot go for the operation. Now I got no more pain. It's something like people got toothache, they cannot uh, extract the teeth. Right? So when they going to have toothache already, now they can extract the teeth. So he's having the same mindset. Right? So I said, better don't. I said, you better don't go for the operation. Right? So I feel so happy, and so I really congratulate you. After taking MSM, right, you are free from the pain, right?
Yeah. Sometimes
So
our body just need a little bit of push, just
yes,
need a little bit more this nutrition for our body to rebuild themselves, to repair the tissues, including our bones.
yes.
Yeah, so everyone we
Come back to
encourage.
a very interesting story. Now it become interesting, but that time is very terrible, horrible, right? Feeling our very close friend, like Chris, right? Close friend of mine and also close friend of Rosa. One day we received a news. He was coma, right? He coma because he was stepped by an elephant.
Wow.
His rib
It
was
came out in the
broken.
newspaper.
Yeah, it came out from the newspaper.
Yeah.
The ribs are broken. Right? At the same time, the liver also burst. The heart also burst. Right? So actually, the eyes also poke up already, and the doctor tell the family like to do some preparation on it. Right? So it is lucky thing that they believe the family members. They also believe in RBC products. So he take the RBC biomedical products and let this Chris take. He was in coma, no?
Yeah, actually, Chris was scheduled for operation because the liver was swollen.
Yes. So he took the products, right? For 2 days, he woke up. For 5 days, right? He can walk around in the hospital. Can stand up and walk around in the hospital. And
Yeah.
he said, all this credit, he said, is the RBC credit. So MSM plays a very important role in our, in our health. Everybody has to take care of our bone health. And MSM not only take care of the bone, it take care of our muscle, it take care of our nerve. Okay.
Yeah, and the joints also. The joints are very
Yes.
important. MSM will
Joint. Yeah.
repair your soft tissue of your joints, so they are
Yeah.
very good for to
Mm.
avoid any joint pain. Yeah, but
Yes.
of course, we advise you to have a very good diet and lifestyle also.
Of course. Mm.
Yeah, nutrition is something that as we call it supplement, right? To supply extra as a supplement for your healthy life. But anytime if you feel the need, please go and see the doctor.
Mm.
Because
Yes.
especially fracture, you have to go to the doctor immediately.
Of course. Mm.
Yeah.
So, and also the doctors, besides doing all the treatment and operation, a lot of time they will also recommend MSM. There are a lot of MSM in the market, but ours is microhydrin MSM. Right? We guarantee the absorption, right? Because of the molecule is so small, it is 1% of the nano. So when what we absorb, okay, and also together you also have blend with vitamin C. Right? You take MSM, you want it to be effective, you need vitamin C, and you need the absorption for it. That's why MSM is one of the recommended products, right? That I wish everybody, right? Those who have people, anyone suffer from the bone pain or whatever, you can see the effective result.
Yeah. Prevention is always better than cure, right?
Yes.
Yeah. So before you get very serious, please just supplement your diet with some good nutritional product. Yeah.
Yes.
So
Okay.
obviously it's a biomedical nutrition, which is first of all very safe, and then also very effective and very natural for our body, because we are natural beings. So we need something natural to go in, which will give us the best effect and the safest effect.
Yeah.
Mm.
Okay. So I pass it back to Sue-Ann for the roundup.
Yeah, thanks, Danny. It's really wow. It's great to hear all those testimonies. So I'm sure those friends of yours, most of them are your friends, right? Who believe, you and believe the RBC products, and because they choose to try, they actually see the results. It's so amazing. Especially the one that you say about Chris, is it? That was stomped by the elephant. And the way you explain about the liver and the heart is
Maybe we know more about Chris' story. Chris was driving on a highway at night with a friend, and then they, halfway, those highway are not the very big NKVE, so they don't have a rest area. They don't have a toilet there. So they nature call. So they think, let's get down and ease ourselves. So when they get down, they didn't notice there's a herd of elephant nearby. So they squat down, and then when they're ready to go, the elephant is actually the elephant was startled by them. The elephant got a shock, so they start running, they start walking, so step on Chris. Lucky, the friend was able to escape and make a phone call to call the ambulance. Now, if both of them are in the same condition, so it's a gone case because nobody can call for help. So luckily, the friend can call for help. So it happened. It is not only an accident; it's a very special accident. Now we are laughing over it, but at that time we are so worried.
I think next time we have to invite Chris to talk about his story, right?
Yeah, that'd be good. I also
that
like the
time was
story.
very
Yeah.
terrible.
Yes,
that
I
time
also
was very terrible.
I also
Now
like
it's
the
very
story.
interesting.
I also like the story you shared about the Wendy, is it, that she has got a double S bone? And I know of a lot of children, when they reach about 12, they have to go for the operation, because when it reaches 60 to 70% of the of the curve, the doctors will normally recommend them to do for operation, and it's quite scary actually. But I think nowadays the operation is done in a very fast manner. Within 2-3 days they can be discharged. Yeah.
Yeah.
But
Yeah.
sometimes it's a very,
It's a
it
risk.
can be very risky.
Yeah, that's right.
It's
That's right.
anything regarding our skeleton.
Yeah.
Yeah.
Any kind of operation, there's a certain risk
True,
Yes.
true.
because we need to go through the aesthetic.
Yeah.
So it's like even if you go for operation, this nutrition will help you because they help you to prevent further infection. They help you to minimize the inflammation in the wounds, and
Yeah.
they also help you to rebuild your body because they supply the good nutrition for your body to have the strength to rebuild themselves.
Mm.
And also
Even slip
overall,
disc, even slip disc, slip disc is the bones, inside the bones, there is a sponge, right?
yes.
In between the sponge.
Mm.
Actually, this is very tightly closed, right?
Mm.
This sponge, if this any fractures or whatever, the water will go from the move up from the sponge there, right? It goes to any part of our body, become water retention. It depends which part of our body is immune system is down. Some people go to the heart, some people go to the lung. Lung is the most common one. It attracts water. Like some people go to the liver, some people go to the kidney, right? And I have one case, it's really worse. It goes to the brain,
Mm.
right? And happen to be a baby. It's because her problem is because of the slip disc problem. So all this bone problem, muscle problem, nerve, sleep this, we have to pay some attention. And it is lucky that MSM, MSM actually is named as a natural pain killer. There's a book, right, by Dr. Jacob in 1982, if I'm not wrong, right?
Mm.
So
Yeah.
it is a natural painkiller. So even you have any bone pain or whatever, right? You take MSM, right? You find that the pain release very fast.
Yeah.
Wow. So which means to say that coming back to the skeletal, right? For those children who have gone for those operation for their S bone, right? So it is very important for them to take MSM as part of their supplements,
Yes,
right? To be able to
yes,
heal the bones. Yeah.
yes. Because you go for operation, it may hurt the bone marrow, right? So once you hurt the bone marrow, the blood will be there. If you take MSM, you will eliminate all the plaques. Because if you take MSM, also our body will produce nitric oxide, NO, right? So it will eliminate the plaques, the blood plaques. So it
So,
helps.
so which means that it also applies to those who have gone for knee replacement, right? They have
Yes.
done knee replacement, so it's a must for them to continuously
Mm.
take MSM to help support the condition of the knee.
Especially those people who have taken one side knee replacement. The other side will be, first of all, it's deteriorating. The
Yes.
structure is deteriorating. So it's good to help your body to rebuild some tissue and to maintain a very healthy bone structure when you are still not in need of doing the operation.
I
Yes.
see.
So also
Alright.
go for sinus operation, right? It is also bone operation. This is also soft tissue, right? Those who go for the sinus
Oh.
operation.
Oh,
Yes, yes.
so which means they have to take MSM also to help.
Yes, you will help a lot.
All right,
Right.
all right, all right.
No, this is made of bones.
Yeah, because one of my relatives just went for operation recently, just a few days ago. So I
A
should
lot of
recommend him
a
to
lot
take.
of people think of bone means very hard one. All the hard bones, they forgot all these soft are bones. These are all soft bones, right?
Oh.
If without the bones, we become jelly already. No more shape already.
So
Tenny, just now you mentioned about the hum, right? So what about those old people? You know, there are some old people whereby they have got a hum on their back. Does MSM help them, or is it too late to take MSM?
I do not know whether it is too late to take MSM or not. But anyway, I will still encourage them to take MSM because it releases the pain. You don't forget, because of that harm, this Wendy, the whole body is aching, The whole
lot of
body.
pain. You can
Ah.
imagine there will be a lot of pain because the spinal cord is surrounded or engaged with the nerves and blood vessels.
Mm.
So it's
So
affecting the both
MSM,
organs.
release the pain.
I
Yeah.
see.
I cannot say it help the harms.
Yeah.
Right.
But anyway, the MSM will help the person, even though the harm might not be fully recover. We don't know whether it will, because we see so many miracles. We don't know. We cannot say it will recover or will not recover. It's all up to God, right? So we are talking about, if you take MSM, your other part of your body, there are so many part of your body which has bones. So strengthen the other part of your body, so your back will not have so much burden.
Let's share my experience. I almost forgot. Because I'm fully recovered. Okay. One day, my leg, back side of the leg, it was hurt by the hanging rope. The one sai sam, okay.
Yeah.
So it hurt my leg. So it was it swells. Okay. At that time, I didn't have MSM at that moment. So I take other products, I rub all the oils and whatever, and I see all the sensei, Tita and all this to do all the things. Hopefully it go off, but it didn't go off. It was with me about 3 months, right? Then later I received my MSM. When I received my MSM, I take it for 2 weeks, right? It is no more swelling. Okay, the pain actually go off in less than 5 days. It has been pain for me for a few months already, So
Hey,
that
for
is
your
my
case,
own experience,
for
right?
your case, I would say all the nutrition that you take over the last 3 months also help. Just that the
Yes.
MSM is very lucky. They come at the right time when your injury is about to be healed. So they come in. So you think MSM is the good thing.
I almost forget about it until now we talk, then I recall. This is my personal experience. I always feel that whatever problem you have with your bone, right?
I just want to highlight that MSM actually is a glucosamine. So everybody know about this glucosamine. But MSM, the difference, the extra point is they have the MH. So they make absorption easier and faster. We take so many things. We drink a milk. We have a lot of vegetable that contain calcium. We think it will help us, but what if you cannot absorb those things into your body? Theoretically, they have the ingredients, they have the vitamin, they have the chemical you need. But if you cannot absorb it, it's as if you have not taken it at all, right? So MSM, they have this microhydrin, and we have already tested it. The absorption is so fast, so good. So that's why we have so many people happily after taking it for 2 weeks or so, the pain and the injury are healed and recover. So just try out. We talk so much, so if you don't try out, you will never know.
Yeah, that's right. Yeah.
Yeah. So I think we end the session today.
Yeah.
So thank you very much for everybody online for watching. So we see you next time. We will be coming up with other topic next time in the next session. So pass it back to you, Sue.
Okay. All right, thank you, Rosa. All right, thank you, Rosa. Thank you, Tanny, for sharing the wealth of experience you have with RBC products. And I believe, as we learn today about bone health, I'm sure we have got friends, relatives who we know that would need this product, because bone is an issue that a lot of people has from young to old. Like even Tanny, you mentioned, even the sinus also is a bone, but most of us forgotten because we thought it's just the skeletal.
It's a nose.
Bone. Yeah.
It's a nose.
So it's good. Today I learned something. So at least I can share this to my relative who have just gone for a sinus operation. So it's good. It's good. I've learned a lot of things, and I'm so glad to have been introduced RBC product by Rosa, and knowing them and seeing their passion in sharing RBC product is amazing. And I believe it's at the end of it, when you hear testimonies, you know, of people being helped, I believe all of us will be very happy and for their lives, you know, and be very grateful because it's because they trusted RBC, therefore they can see the results in their life. All right. So, okay, I think if there's no other questions, we call it a day. And thank you, friends, for joining us this evening.
Thank you.
All right.
Thank you.
Bye.
See you next time.
Bye-bye.
Bye.